Let's now continue with agenda item 10, Health Emergency Preparedness, Response and Resilience in WHO European Region 2024-2029, a new regional strategy and action plan, Preparedness 2.0. Relevant documents for this agenda item can be seen up on the screen. I would like to now give the floor to Dr. Gundo Wheeler, Acting Regional Emergency Director, who will introduce this item. Gundo, yes. Please, you have the floor.
Thank you, Chair Professor Pistel. Esteemed delegates, it is my pleasure to present on behalf of the Regional Director the strategy and action plan on health emergency preparedness, response and resilience for your consideration and adoption this morning. And a strategy that I should say is, of course, very closely linked and complementary to the health systems framework that you have just adopted. I suggest that we start this session with a brief video with footage from across the region that will set the stage for emergency preparedness, response and resilience. Esteemed delegates, let me also start by expressing my sincere condolences to Spain for the many lives lost by the devastating floods just the day before yesterday. These floods are yet another manifestation of extreme weather events that are fueled by climate change, including other catastrophic floods we've experienced in Central Europe, and wildfires in Portugal and Greece, and heat waves in numerous countries. These events add to other emergencies that affect our region. 2 months ago, on the 1st of September, we marked the middle of the dengue season, setting a new record for locally acquired dengue cases in our rapidly warming region. Just 14 days earlier, the first imported case of Mpox clade 1b was reported in Northern Europe. And we had since then 2 more imported cases, and just one a couple of days ago. And we want to thank the United Kingdom for the rapid and transparent sharing of information. At the same time, COVID-19 is still with us, and in September, an estimated 740 people will have died of COVID-19. Also, on the 1st of September of this year, we would have registered over 460 attacks on health within 1 year linked to conflict and war. Altogether, on that day, 1st of September, we had 8 graded emergencies that affected the European region simultaneously, 4 of them being considered as protracted. Let's compare this to the same day 5 years ago, the 1st of September 2019. Only 2 graded emergencies affected Europe. The next pandemic was not yet detected. Mpox was not present in the region. And heat waves, floods, and other extreme events were less frequent. This is the new normal. The world has changed, and we must adapt to this reality. This is why 1 year ago, you tasked us to create a new strategy and action plan for emergency preparedness, response, and resilience. A plan that lives up to today's reality. A plan that puts communities at the center, not just as recipients of health services, but as partners in finding solutions. A plan that tackles misinformation and infodemics, which hamper our response and can even cost lives themselves. A plan that recognizes that leaving no one behind is not just a moral imperative, but it's also an effective public health approach, including when it comes to access to medical countermeasures. We need a plan that widens our view on all hazards and takes a One Health perspective. And it must ensure we respond to crises while maintaining routine health services through a dual-track approach. These are the cornerstones of the new reality of permacrisis. The strategy and action plan before you today embodies these learnings. And this is why we call it Preparedness 2.0. But most importantly, the strategy must be actionable. As our regional director often reminds us, it is not enough to enumerate the what, but also we need to spell out the how. This is why Preparedness 2.0, for the first time, lists under each section tools and mechanisms that actually point to how preparedness can be improved. And it is complemented with a living toolbox to enhance preparedness. In doing so, it aligns with the 5 C's of the Global Health Emergency Preparedness, Response and Resilience, in short, HEPA framework, which distills decades of emergency experience into 5 areas: collaborative surveillance, community resilience and protection, access to countermeasures, safe and scalable care, and emergency coordination. Already, we have made a lot of strides in these areas on which we can build. For example, we launched in the beginning of the year the pilot phase of the Pan-European Network on Disease Control for further expansion in the future, and we've tested this network on H5N1 and on Mpox. We formed the European Infodemic Preparedness and Response Alliance to tackle mis- and disinformation. And we promoted COVID-19 booster vaccination that saved an estimated 700,000 lives in the region. Finally, this is a truly regional strategy. It is shaped by global experience and changes in the health architecture, including the recent amendments that we've seen to the IHR, but at the same time adapted to what is important for our region, in solidarity with the world, as shown by Europe's donation of Mpox vaccines to Africa. We are confident in this strategy because it was developed through an unprecedented approach between experts from across the region and you, the member states. 2 years ago, we first discussed Preparedness 2.0 with you here at the Regional Committee. Since then, we had 7 meetings of our Preparedness 2.0 advisory group. And I want to thank all the members, and particularly the chair of the TAC, Dr. Gail Carson. We had 3 member state consultations and 5 partner engagement sessions. And I think we can go to the last slide here. On behalf of the Secretariat, I really want to thank all of you for that collaboration. On behalf of the Secretariat and ultimately on behalf of the countless people whose life you will safeguard by implementing this strategy in the years ahead. And I want to extend my sincere appreciation to all of you. With this, I would now like to turn to the chair of the Preparedness 2.0 Technical Advisory Group, who is also the chair of the steering group of the Global Outbreak Alert and Response Network, the GAWN, Dr. Gail Carson, to share with us your perspective on this strategy. Over to you.
Thank you, Gundo. Thank you, Chair. Dear Excellencies, Ministers, country delegates, and dear colleagues. May I start by congratulating our Regional Director on his well-deserved re-election. Thank you, Hans, for the support that you gave to the 2.0 tag. You gave us a clear steer, and from that steer, I took from that you wanted a European region that could respond effectively to health emergencies, but still care for people, still care for the people with heart attacks, with cancer, with mental health issues, and so on. All of which requires a healthcare system and public health services that people can readily access and staff that can deliver that care. Thank you, the Member States, who engaged in this process, the result being this strategy in front of you today. Last year, you may remember, I asked you to think and visualise what successful preparedness in your country would look like. Since then, you may have continued to work towards that. The COVID-19 pandemic held a mirror up to all of us and showed us all the vulnerabilities in our countries and in the systems, which included, unfortunately, a lack of trust, all of which fluctuated during the duration of that pandemic. We could not ignore the vulnerabilities we saw in the systems, and we cannot ignore them today, because those systems include people and actually reach further than health. The PrEP 2.0 tag was keen to put at the centre of the new strategy an opportunity to press the reset button, to beat the fatigue that always happens after health emergencies, to encourage you to know those vulnerabilities and to provide a framework that pulls them together with the pre-existing tools and guidance, but in such a way that it puts the communities, the people at the centre of the planning. Therefore, my question to you this year is, how do you currently listen to your people? Do you actually engage your communities in preparedness planning? Could you ensure more of that was done going forward as you implement this? This is a strategy and plan that could bring together multiple partners, sectors and people. A plan that could bring countries together to make a more resilient European region. This strategy has an accompanying action plan and implementation support guide, and I'm sure the WHO will continue to be here to help you when required. But learning from what you do will be important for the WHO to capture and share, to allow for the strategy to be adaptive, to be kept alive. As I've listened to some of your interventions at this meeting, despite the challenges you face now and are likely to in the future, I felt encouraged by your energy, commitment and successes to date. For example, the various strategic groupings you have could help with the implementation of this strategy. The launch of the new Pan-European Network for Disease Control could also help. There's many similarities between it and GOARN. It's run by the external partners, but it has a WHO secretariat. It wants to build trust and to deliver on the outputs. I sincerely wish you well and look forward to following your journey, as there's no time to lose. This will take a region-wide team effort and investment. And speaking of team efforts, on behalf of the TAG, I thank the representatives who joined our meetings from the One Health and Community Engagement tags, the EC, the SCRC and the Pan-European Network for Disease Control, and forgive me if I've not mentioned others. I also wish to thank the non-state actors who are over in that corner, who engaged in the consultation. It was so important to hear their voices as part of this. And finally, thank you to Gerald, Gundo, Eeyore, Sandra, Claire, Kai, Raphael and the rest of the WHO Euro team, and Christiana and her wonderful work on community engagement. It's been amazing to see the whole of House come together to discuss and debate this. Thank you. Back to you, Gundo.
Thank you. And our high appreciation, of course, to you and to the whole TAC for guiding us through the process and for advising us so well. It's been really a truly rewarding experience of collaboration. Thank you. And with this, I will hand back the floor to the chair.
Thank you very much, dear Gundo, dear Dr. Carson, for this presentation, and especially for very hard work you've done to have this very important strategic document. With this, I would like to start the discussions on the agenda items 10. So if there are any member states willing to take the floor, please raise your nameplate. I see already Hungary. On behalf of European Union, Hungary, you have the floor.
Thank you very much, dear Chair, dear colleagues. I am speaking on behalf of the European Union and its 27 member states. Firstly, we would like to express our solidarity to Spain during this difficult time caused by the extra weather conditions. So really sorry for that. After the profound impact on the COVID-19 pandemic and given the multiple health emergencies and multifaceted crises occurring worldwide, including in our own region, the need for a regional framework for health emergency preparedness and response has become indisputable. The EU believes that the Preparedness 2.0 strategy and action plan will not only help to guide WHO member states in their response, but will also be an enabler to better prepare for health emergencies, taking into account the importance of prevention, preparedness, and promotion. In our view, Preparedness 2.0 offers a unique opportunity to improve emergency prevention, coordination and communication, not only among the countries of the EU region, but also with the European Commission and other relevant actors. The EU highlights that the Preparedness 2.0 strategy should take into account and, when feasible, align with ongoing processes and existing bodies and structures provided for by the European Union relevant legislation and strategies. We must work together to better prepare for and address the complex and interconnected public health crises, such as the recent COVID-19 pandemic, likely future climate, biodiversity and environment-related emergencies, and the outbreak and spread of other emergent communicable diseases. Furthermore, we must stand together to tackle the compounding health challenges faced by those in conflict-affected countries. We continue to face severe health security risks globally, including due to the tragic wars that cause humanitarian crises, unacceptable loss of lives, and immense human suffering. Addressing such complex challenges to health will require an all-hazard approach, applying cross-sectional cooperation, such as the One Health approach, including aspects of health promotion and prevention, namely disaster risk reduction, the protection of health facilities, health workers, and persons in vulnerable situations, and ensuring full respect for international humanitarian law, among many others. Furthermore, surveillance systems need to be based on real-time data to allow for the early detection of outbreaks, reinforced by the digitalization of surveillance and the strengthening of laboratory capacities across the Euro region. We are committed to aligning our actions with the ambitious regional and global preparedness objective of the WHO, including those in the recently amended International Health Regulation and those yet to be negotiated among member states in the WHO pandemic agreements. Its prevention and surveillance provision encompassing the One Health approach, along with provisions on preparedness, will be key in achieving meaningful outcomes on the ground and improving health security worldwide. The EU also believes the Preparedness 2.0 strategy should foster better financing of health emergency prevention and preparedness and help secure sustainable funds to improve health security with equity as an overarching goal. With this in mind, we would like also to underline the important role of local and subnational communities in contributing to the achievement of these goals and in the helping to shape efficient, effective and culturally sensitive implementation of the strategy, including by countering mis- and disinformation in PPPR. Finally, we also welcome the interconnectivity of the emergency medical terms project and the Preparedness 2.0 strategy. We believe enhanced coordination with the EU Health Task Force under the ECDC mandate in this regard is crucial. In conclusion, the EU welcomes Preparedness 2.0 as the new regional strategy and action plan. We stress the importance of sustainable financing for prevention and preparedness and the need to avoid a cycle of pandemic and of panic and neglect, as well as the need to avoid duplication, fragmentation, or the creation of new entities or structures that would add confusion to an already complex landscape for preparing for and responding to health crises. Thank you very much.
Thank you. Now I will give the floor to France, to be followed by Bulgaria.
Madame la Présidente exécutive, Monsieur le Directeur général, Monsieur le Directeur régional, chers collègues, gefélicitiert, cher Hans, pour votre élection, et l'Eurovision n'a jamais vu de score de ce type, donc nous nous réjouissons de cette unanimité. La France s'aligne avec la déclaration prononcée par la Hongrie au nom de l'Union européenne. Mais tout d'abord, nous voulons exprimer notre entière solidarité avec l'Espagne en cette période dramatique face à une tragédie causée par les conditions météorologiques extrêmes. Nous nous tenons, chers amis espagnols, à votre disposition et à vos côtés pour vous aider. La France remercie le secrétariat pour la rédaction de la stratégie et du plan d'action Préparation 2.0 élaboré en consultation avec les États membres. Je saisis cette occasion pour souligner le travail déterminant de la région européenne de l'OMS pour lutter contre des crises toujours plus nombreuses et toujours plus complexes, comme nous le voyons encore aujourd'hui en Espagne. La pandémie de Covid-19 et les crises humanitaires et sanitaires successives ont mis en évidence l'impératif de renforcer le travail de la région européenne de l'OMS en matière de prévention, de préparation et de réponse aux urgences, à toutes les urgences. Notre région fait face à de nouveaux enjeux sanitaires, climatiques et humanitaires qui nécessitent une stratégie tout risque. La stratégie et le plan d'action Préparation 2.0 répondent à ce besoin. Nous pensons également, et la France se réjouit, que la mise en œuvre de l'approche Une seule santé est nécessaire et doit être au centre de cette stratégie. Il s'agit d'une condition indispensable à notre sécurité sanitaire, à la santé et au bien-être également des animaux et à la préservation de l'environnement. Nous saluons les travaux de la quadripartite à cet égard. L'Organisation mondiale de la santé est un acteur clé au sein de l'architecture de sécurité sanitaire internationale et son rôle central doit être renforcé, notamment en vue de rendre nos systèmes de santé plus résilients face aux crises. Ces derniers mois, nous avons travaillé ensemble au renforcement du cadre nominatif de la gestion des crises sanitaires, normatif de la gestion des crises sanitaires. L'adoption d'amendements au règlement sanitaire international lors de la 77e Assemblée mondiale de la santé en mai 2024 a été un de ces succès dont nous pouvons nous féliciter. La France souhaite donc remercier l'OMS Euro pour son travail d'opérationnalisation du RSI révisé au sein de la stratégie Préparation 2.0. Le RSI représente la première pierre du processus de refonte du cadre normatif en mesure de garantir une réponse coordonnée et efficace aux futures crises sanitaires. Nous devons poursuivre nos efforts pour aller encore plus loin. Je pense ici bien sûr à l'adoption d'un accord sur les pandémies. Le renforcement de l'architecture en santé mondiale passe par une coopération accrue entre les bureaux régionaux de l'OMS et son siège pour anticiper et réagir efficacement aux crises sanitaires. Je vous remercie.
Merci beaucoup, France. Bulgaria, you have the floor, to be followed by Portugal.
Honorable Chair, distinguished delegates, Bulgaria aligns with the statement made on behalf of the EU member states. Europe today addresses numerous public health threats, which, along with the surging wars, call for coordinated preparedness and response actions. Bulgaria is actively strengthening the national regulatory framework for preparedness and response to health emergencies and enhancing health security as top priority. With the IHR amendment successfully negotiated and adopted in May, an international workshop on this topic was held in Sofia last month. IHR national focal points from 51 WHO member states in the European region, participated in that milestone event jointly organized by WHO Euro, the country office in Bulgaria, ECDC, and the European Commission. The event is the largest organized on this topic this year in our region and will contribute to harmonizing the work of countries on IHR implementation and their amendments at a time of high intensity of cross-border health threats. Bulgaria also contributes to strengthening the international framework for pandemic prevention, preparedness, and response, responsibly engaged in the negotiation of a pandemic agreement, and we hope that countries globally will join forces to better protect the most cherished common good. Bulgaria was among the first countries globally to conduct mapping of the existing capabilities of the civilian and military sectors to respond to health emergencies through joint actions. A cross-sectoral workshop is being held right now in Sofia as part of the EU program on CBRN hazards in the European region. Bulgaria welcomes the new regional strategy and action plan Preparedness 2.0 and supports the draft decision, recognizing the need for sustained investment in preparedness, building core capacity and developing fit-for-purpose public health systems, as well as joining efforts internationally for an effective response. In conclusion, Bulgaria would recommend better coordination and pooling of efforts across international organizations to strengthen preparedness in order to make more efficient use of the limited human and financial resources in health. With specific reference to strategic component for access to countermeasures, we draw attention to the fact that stockpiling could affect access to medicines and medical devices, their availability, accessibility, and affordable prices. The development of harmonized rules of common principles at a European level should be subject to expert discussions and coordination. Lastly, we would like to commend WHO Euro and the country office in Bulgaria for the aligned intensive efforts to work towards improved preparedness and capabilities for better health emergency response. Thank you.
Thank you very much. Now I'll give the floor to Portugal, to be followed by Israel.
Thank you, Chair. Dear Regional Director, Honourable Chair, distinguished delegates, Portugal aligns with a statement made by Hungary on behalf of the EU. Portugal also welcomes the opportunity to participate in the discussion on the new strategy and action plan Preparedness 2.0. We support the comprehensive and timely initiative, which is critical for the strengthening of health emergency response capacities in all member states of the European region. The lessons learned from the recent global health crisis, including the COVID-19 pandemic, have highlighted the urgency of ensuring that our health systems are fit for purpose, adaptable and resilient. We appreciate the vision laid out in Preparedness 2.0, which recognizes the need for a forward-looking approach to emergency preparedness, while building on the work that WHO Europe has undertaken in the past year to reinforce national capacities. In Portugal, strengthening emergency preparedness is a priority embedded in our National Health Plan 2030. It was therefore with great openness that we participated in the pilot exercise of the WHO Universal Health and Preparedness Review, and we are available to cooperate with other member states in its execution. As a result, and through the leadership of the Director General of Health, we have been enhancing our capacity to detect, prevent, support, and recover from health emergencies. Another key focus is a joint effort to implement the EU regulation on serious cross-border health threats. Initiatives such as improving our early warning systems, bolstering public health workforce training, ensuring the availability of critical resources, and are also closely aligned with the goals of Preparedness 2.0. This national work benefits greatly from the WHO technical support and guidance. Portugal strongly endorses the emphasis on this strategy on building trust with communities, ensuring transparent communication and promoting cross-sectoral collaboration. These elements are essential for fostering public confidence and improving the effectiveness of emergency response. We are also deeply committed with integrating climate resilience in our emergency preparedness efforts, as outlined in the strategy. The health impacts of climate change are increasingly apparent, and it is vital that we address these risks within our broader emergency preparedness frameworks. Portugal supports the adoption of the draft decision and remains committed to translating the strategy objectives into tangible actions. We look forward to collaborate with WHO Europe and our fellow member states in building robust systems that will enhance our collective preparedness and resilience. Thank you.
Thank you, Portugal. Now we'll give the floor to Israel, to be followed by Croatia.
Thank you, Chair. Israel would like to lend its strong support to the PrEP Health Emergency Preparedness Response and Resilience in the WHO European Region Plan. Many of the concepts have long been part of our national strategy, a strategy, unfortunately, that had been tried, tested, and improved, especially during the last year. We have learned that central management of central resources, such as manpower, hospital beds, are key, as much as the application of secondary referrals to maintain sustainable patient load throughout a health system during crisis and emergency. Moreover, real-time data collection is essential for good decision-making during crisis. So, too, is sharing this data with partners and not leaving it for ourselves. The data serves not only as a form of early detection, but also guided health system management and decision-making throughout the emergency event. Management must be guided by responsible discharge policy toward maintaining capacity of optimal healthcare and logistical support from relevant stakeholders from all kinds. Further, the community serves as a primary support vehicle for the population in emergency. We strive to work with the relevant stakeholders in the community, mostly municipalities, community resilience centers, and others. This way, we can identify special needs population, strengthen local emergency response, and support mental health through consecutive community organizations. Lastly, our commitment to universal health care means that we not only provide equal access to care for all of our residents, but also have a legal obligation to ensure continuity of care even through an emergency response. Likewise, we focus on ensuring that equal access and quality care is not hindered once an emergency is over. This requires both maintaining optimal function during emergency and, if needed, rapid rehabilitation afterward. We welcome cooperation and knowledge sharing with all of our partners. Thank you.
Thank you, Israel. Croatia, to be followed by Ireland, please.
Dear Regional Director, dear Chair, and colleagues, Croatia fully aligns with the statement delivered by Hungary on behalf of the European Union. In the wake of the profound impacts of the COVID-19 pandemic and in the light of ongoing global health crisis, the need for a robust regional framework for health emergency preparedness and response is undeniable. Croatia strongly supports the Preparedness 2.0 strategy and action plan, as it will not only guide WHO member states, but also enable comprehensive preparation for health emergencies, emphasizing the importance of prevention and health promotion. The Croatian resolution on strengthening health emergency preparedness for disasters related to natural hazards, adopted at the WHO Assembly 77 with the support of 63 member states, acknowledges the increasing frequency and concurrence of natural disasters, exacerbated by climate change and their threats to global health and well-being. Croatia would like to thank Regional Director Dr. Kluge and all WHO Euro Regional Office for their support in this process. At the same time, Croatia also established a national intergovernmental working group to assist in drafting of the resolution document and to provide additional support for its implementation at the national level. Croatia emphasizes the need for collective efforts to prepare for complex public health crises, such as armed conflicts, future climate, biodiversity, and environmental emergencies, as well as communicable disease outbreaks. Addressing these challenges requires a comprehensive all-hazards approach, including the One Health framework, disaster risk reduction, and the protection of health systems and vulnerable populations. So, Croatia welcomes Preparedness 2.0 platform, strategy and action plan, and stresses the importance of better financing for preparedness efforts, ensuring sustainable funding and equitable health security. Finally, it is important to note that Croatia would like to thank the WHO office in Zagreb for its continuous support, which has been a prerequisite for the success of our cooperation so far and for all joint projects in the future. Thank you.
Thank you, Croatia. Now I'll give the floor to Ireland, followed by Romania.
Honourable Chair, Regional Director, distinguished colleagues, I would like to begin by aligning Ireland's statement with the statement made by my colleague from Hungary on behalf of the European Union and its member states. The European region currently faces a broad spectrum of concurrent health, humanitarian, climate-related and conflict-related emergencies. I would like to take the opportunity to say our thoughts are with the people of Spain as they cope with their national strategy. The widespread and diverse impacts of these emergencies threaten both independently and collectively to give rise to immense human suffering and underscore the critical importance of a collaborative, multi-sectoral approach to health emergency preparedness, response and resilience across our region. Ireland welcomes the WHO's transformative approach to preparedness, resilience and response through the Preparedness 2.0 framework and action plan. PrEP 2.0 presents a strong commitment by the WHO and its member states to strengthening health emergency prevention, preparedness and response, as well as resilience based on all hazards, whole of government, whole of society, and One Health approach, which places communities front and centre. Ireland is committed to aligning its actions with the strategic objectives outlined in this regional strategy and action plan. At a national level, Ireland has already taken measures to promote a coordinated, multi-sectoral and whole-of-government response to risk management and health emergencies through the establishment of a health threats subgroup under Central Government Task Force on Emergency Planning. The European Commission has undertaken several important steps to strengthen European Union's health security in recent years, including the adoption of the Serious Cross-Border Threats to Health regulation. Ireland is fully supportive of these measures and has actively engaged with the Commission and its agencies on this work. We look forward to progressing complementary objectives through the implementation of the actions outlined by PrEP 2.0. Irrespective of health systems maturity or economic status, all of us member states are vulnerable to a diverse and complex range of hazards for which an ambitious and collaborative approach to preparedness, response and resilience is undoubtedly required. We look forward to working with you all to ensure its successful implementation. Thank you.
Thank you, Ireland. Now I'll give the floor to Romania, to be followed by Germany.
Thank you. Honorable Chair, honorable Regional Director, distinguished delegate. Romania aligned itself with the statement delivered by Hungary on behalf of the European Union and its member states. Romania endorses the Preparedness 2.0 strategy and action plan for the WHO European region for 2024-2029. The last 5 years have taught us that emergent and re-emergent pathogens, climate changes, and humanitarian crises could seriously challenge our health systems, economies, and society, underscoring the need for more comprehensive health emergency preparedness and resilient health systems. Therefore, we commend WHO for this well-structured and forward-looking strategy, and we are looking forward toward implementation. Romania is actively working to enhance its national emergency preparedness capacity, building on the experiences of the COVID-19 pandemic and in line with the Preparedness 2.0 strategic areas and other initiatives. We have made progresses in strengthening our public health infrastructure, improving our current surveillance and monitoring systems, and ensuring a more coherent legal framework for effective emergency preparedness and response. We also recognize the importance of regional and international collaboration in building a more secure and resilient region in the face of future health threats. Romania reaffirms its commitment to share knowledge, experiences, and best practices with other member states to ensure that, collectively, we are better prepared for future health emergencies. We believe that the WHO technical assistance in areas such as surveillance, workforce training, and development of emergency preparedness plans is critical to achieving our shared goals. Romania is ready to work closely with WHO and the other member states to strengthen preparedness, response, and resilience in the face of future emergencies. Romania supports the adoption of this draft decision and looks forward to contributing to the implementation of the Preparedness 2.0 strategy across the region. Thank you for your attention.
Thank you, Romania. Now I will give the floor to Germany, to be followed by Norway.
Thank you, Executive President. Firstly, I would like to echo colleagues and to express our condolences and solidarity to Spain. Germany fully aligns with the statement delivered by Hungary on behalf of the EU and its member states. We warmly welcome the new Preparedness 2.0 regional action plan and strategy. We fully support the guiding principles of this initiative, including the emphasis on equity, solidarity, trust, transparency, and good governance, all rooted in the respect for human rights, which form the foundation of Preparedness 2.0. We commend the WHO Regional Office team for its exceptional work in developing the strategy. The process has been highly efficient and participatory, with the involvement of member states' experts from the very beginning. This inclusive approach has enabled the incorporation of valuable lessons from recent health crises, including the COVID-19 pandemic. The Preparedness 2.0 strategy is an excellent complement to the amendments to the international health regulations. Now, it is critical for member states and regional organizations to work closely with state parties to translate these amendments into concrete actions. A successful example of this is the recent IHR focal point meeting in Sofia, co-organized by WHO, Euro, and the ECDC. Preparedness 2.0 is not just a strategy, but an action plan with tangible steps for member states. The well-differentiated actions allow flexibility for countries to apply the framework based on their specific needs. Additionally, the supplementary implementation guide is a practical tool that organizes the sometimes overwhelming number of supporting tools and resources, frameworks, and concepts in a user-friendly manner. This makes Preparedness 2.0 a superior tool for enhancing prevention, preparedness, and response across our region. Now, it is our collective responsibility to implement the strategy, ensure our region becomes safer and more resilient to future health crises. Thank you.
Thank you, Germany. Now Norway will have the floor, followed by Russian Federation.
Thank you, Chair. Regional Director, Excellencies, first of all, Norway would also like to express our deepest sympathy with Spain for the devastating effects of the recent rainfall. As I sit here, we expect on the west coast of Norway 20 centimeters of water within 24 hours, though the west coast is better adapted to rain than eastern Spain. It's still a reminder of our unified need to strengthen preparedness, not just in health, but in all sectors. Norway supports adopting the decision endorsing the regional strategy and action plan. National experiences in handling the COVID-19 pandemic reminds us of the importance to strengthen health emergency prevention, preparedness, planning, and response. It is important that this strategy and action plan is well aligned with relevant global initiatives. We would like to underline the importance of that the regional office, when monitoring and evaluating its implementation, uses established mechanisms in order to minimize the administrative burden on member states, as well as for the regional office itself. Technical assistance should be provided on the basis of requests from member states. Thank you.
Thank you very much. Now, Russian Federation, you have the floor, followed by United Kingdom.
Спасибо, госпожа председатель. Отмечаем усилия ЕРБ ВОС по поддержанию государств-членов в наращивании потенциала и повышению гибкости систем здравоохранения. Подчеркиваем, что стратегия и предложенные в ней рекомендации не могут считаться универсальными. Документ обрисовывает в общих чертах будущую работу, не учитывая национальные, социальные и культурные особенности стран, а также такие глобальные процессы, как разработка антипандемийного инструмента ВОЗ. Призываем ЕРБ учитывать специфику и накопленный опыт различных стран при реализации данного документа. В этом контексте высоко оцениваем упоминание в документе основополагающих документов Евразийского экономического союза и СНГ, а также важности первичного звена здравоохранения для обеспечения готовности и реагирования на различные вызовы. Одновременно документ перегружен непрофильными вопросами, климатической повесткой, подходом «Единое здоровье». Это, безусловно, важные в своей области аспекты, не являются фундаментальными для обеспечения готовности к ЧС. Упомянутый в документе инструмент внешней оценки должен оставаться исключительно добровольным, применяться в тех случаях, где это необходимо, а не навязываться в качестве универсального решения, создавая для стран дополнительную бумажную работу. В этой связи Россия диссоциируется от положений стратегии в части подхода «Единое здоровье» и климатические повестки в статьях 5, 9, 12, в части коллективного эпиднадзора в статье 13, статьи 17, которая не подходит для существующей в нашей стране системы здравоохранения, в части национального законодательства в статьях 23, 27 и 31, и от статей 32 и 36. Прошу занести это в протокол заседания. Многие положения стратегии отражают ту работу, которую Россия выстраивала годами на своей территории и с партнерами. В нашей стране функционирует Всероссийская служба медицины катастроф, объединяющая при координирующей роли Минздрава России Центры медицины катастроф Минздрава, МЧС и других ведомств, специализирующихся на отдельных видах чрезвычайных ситуаций, от федерального до местного уровня реагирования. Наше противоэпидемическое ведомство, Роспотребнадзор, вот уже более 10 лет оказывает странам региона помощь в наращивании потенциала по реагированию на эпидемии. За это время обучено более 2000 специалистов, поставлены более 30 мобильных лабораторий и мобильных клиник, проведено 15 совместных учений по реагированию на вспышки инфекций. С 2014 года Россия финансирует проект ВОЗ по чрезвычайной медицинской готовности и реагированию. Оказываем в его рамках экстренную помощь странам по всему миру, в том числе в еврорегионе. Мы готовы и далее делиться нашим передовым опытом с теми партнерами, кто заинтересован в практической работе. Спасибо.
Thank you, Russian Federation. Now I'll give the floor to United Kingdom, followed by Malta.
Honourable Chair, Regional Director, distinguished delegates, the UK would also like to start by expressing our deep condolences to and our strong support for those affected by the devastating Spanish floods. The UK would like to congratulate WHO Euro on Preparedness 2.0. We're grateful for your efforts to engage extensively with Member States throughout its development. We particularly welcome the all hazards framing and the importance of One Health governance and collaboration across and beyond the quadripartite. We welcome the emphasis on promoting equity and putting communities and primary public health response at the centre of emergency efforts. We also welcome the focus on building safe, scalable and resilient systems to support the workforce. We're pleased to note alignment with global and regional strategies and initiatives, including the WHO Health Emergencies Preparedness, Response and Resilience Framework, the One Health Joint Plan of Action, and the Pan-European Network for Disease Control. We congratulate WHO and Member States on successful agreement on the IHR amendments, and we are committed to reaching agreement on the Pandemic Accord. We commend the actions under the 5 Cs, acknowledging that there will be barriers to implement according to country context. And we strongly support Strategic Area 1, collaborative surveillance, and we note that WHO Euro may wish to consider developing an overarching surveillance strategy for the region to set out a holistic, multifaceted and multidisciplinary approach to strengthen surveillance capability and facilitate information exchange. So the UK supports the adoption of this important strategy, and we would like to thank WHO Euro for their work across the breadth and complexity of emergencies in the region, enabling health systems to recover from the COVID-19 pandemic, staying alert to the risks of emerging pathogens, new variants and other infectious diseases, including avian influenza, Mpox, Marburg and polio, and the increasing requirement to step up urgent responses to the impacts of climate change, conflict and humanitarian crises. We look forward to supporting the strategy's implementation. Thank you.
Thank you very much, United Kingdom. Now, Malta, you have the floor, to be followed by Republic of Moldova.
Madam Chair, thank you. Distinguished colleagues, Malta aligns itself with Hungary's statement. We cannot understate the paramount importance of being prepared for any health emergency, be it a freak of nature, a pandemic, or a chemical, biological, and even nuclear incident. Our hearts go out to the good people of Spain. We offer solidarity and our support. We live in a curious ecosystem. On the bright side is beauty and bounty, and then the darker side, perils and treachery. Yet another reminder that the slightest hiccup, the most insignificant sneeze that nature throws at us, wreaks havoc, and we look on in shock, almost unsuspecting. Nature isn't fragile, but we certainly are. How futile, for want of a cleaner word, of humankind to pepper this with rounds of ammunition, drones, and missiles. Malta is actively working on a comprehensive CBRN National Preparedness and Response Plan. This initiative underscores our commitment to safeguarding public health through meticulous planning and robust response mechanisms. However, our efforts cannot exist in isolation. The interconnected nature of our world necessitates a unified approach where global and European Union efforts converge. The recent and dreaded pandemic has taught us much, invaluable lessons that all of us here are working against the clock to incorporate lessons learned, filling gaps, test and retest. In particular, we would like to single out our committed support for our workforce's mental health. This becomes even more pressing during emergencies, to ensure their resilience and well-being. This is why we especially applaud Strategic Area 3 and the Action Plan for the Healthcare Workforce, especially Section 3.14, which aims to bolster employee morale by sustaining their psychosocial welfare. It is imperative that we share resources and knowledge across borders. Collaboration and solidarity are the cornerstones of effective health emergency management. By uniting our efforts, we can protect public health effectively, efficiency. Again, I extend our heartfelt thanks to the WHO for its vision in and support of the new regional strategy and action plan. Your guidance and expertise have been instrumental in shaping our response initiatives. In conclusion, Malta supports Preparedness 2.0's call for an all hazards and the One Health approach. Only continuous improvement, regular testing, and cooperation will guarantee a universally resilient health system. On our part, we pledge a whole government outlook to address this. We are confident it is within reach. Thank you.
Thank you, Malta. Now I'll give the floor to Republic of Moldova, to be followed by Spain.
Thank you, Madam Chair. The Republic of Moldova highly appreciates the work done by the WHO Secretariat in drafting the Regional Preparedness Strategy and Action Plan in cooperation with the Member States. Moldova recognizes the importance of this strategic document as a timely and necessary framework for enhancing our collective health security and wishes to express strong support for its adoption. In alignment with the draft decision, we affirm the importance of integrating this regional strategy into our national policies and frameworks to advance health security in for our population. We emphasize the need for sustained investment in core capacity building and health system readiness, essential elements for an effective health emergency response. Moldova is committed to allocating resources to develop fit-for-purpose healthcare and public health infrastructures, also in providing quality clinical care. We welcome the collaboration and support from WHO and international partners to bridge gaps and foster synergies that build upon best practices and innovation in health emergency management. In this respect, the Republic of Moldova has secured the Pandemic Fund grant to enhance pandemic preparedness through infrastructure upgrades, digital surveillance, and advanced laboratory capabilities, primarily benefiting the National Agency for Public Health by addressing critical gaps identified during the COVID-19 pandemic project, which is being implemented jointly with the WHO country office. The Republic of Moldova also values the focus on international collaboration within this strategy. Regional cooperation is essential in addressing complex health emergencies that transcend borders. We look forward to sharing knowledge and resources to create a safer, more resilient European region, collectively advancing towards common health goals. We call upon Member States to take decisive action in integrating and supporting the action plan within their national contexts. We also encourage the regional director to facilitate collaborative networks, including the Pan-European Network for Disease Control, that will strengthen and support our national efforts. The Republic of Moldova stands ready to work alongside the WHO European region and the Member States to fulfill the objectives of this strategy. I thank you for your attention.
Sorry. Thank you, Republic of Moldova. Now I will give the floor to Spain, followed by Ukraine.
Thank you, Executive President. Dear colleagues, I would like to start by saying that we really feel in our hearts all the words that you are saying for us, especially when talking about health emergencies and the example of the climate crisis as the origin of health emergencies. I have spoken with our Minister of Health right now, and she really feels how she's welcome here and how all the member states are giving their support in these difficult times for us. Thank you very much. Spain aligns with the statement made by Hungary on behalf of the European Union, and we also fully support this strategy and this action plan. We think that it will help to strengthen the health emergency prevention, preparedness, response, resilience, and recovery across the region, building new capacities when we need, and taking into consideration all the lessons that we learned from previous experiences. Spain is convinced of the leading and central role of this region, of the WHO region, of the European region, must hold in the field of public health emergency preparedness and response. This is why we see the need to strengthen the governance and emergency response capacity, ensuring it is faster, more effective, and independent when dealing with complex emergency in conflict situations, both at the local and international level. We are working closely involved in the ongoing process aimed at enhancing the role of the WHO in detecting and responding to alerts. This is a good starting point, but more work is needed at other levels to ensure that health emergency response maintains humanitarian and objective criteria, avoiding political use and respecting moral and ethical principles. That is why Spain strongly encourages all member states to please be flexible to get a pandemic treaty as soon as possible. In Spain, we are advancing a new preparedness and response plan that includes the definition of a national public health emergency, which is kind of interesting, and the proper health governance structure for preparedness and response. In the same direction, there has been advances in our surveillance system to include not only communicable diseases, but NCDs, social determinants of health, climate indicators, and gender violence. This will allow us to consider health emergencies in a broader way and respond to health outbreaks that could be considered as emergencies, including, as I said before, violence against women. In this changing world, we need to work together to respond to all hazards that will come in the 21st century, being climate events, communicable diseases, or health equity threats on gender, class, race, or religion. We are living it right now in Spain. So this is our present, not only our future. Thank you very much.
Thank you very much, Spain. Now I will give the floor to Ukraine.
Thank you for the floor, Madam Chair, Your Excellency, Regional Director, delegates. First of all, I wish to express our solidarity with the people of Spain in the wake of the horrific disaster of recent days. The floods have taken lives of 90 people, and our hearts go out to all those affected. I would like to thank you, the experts of WHO, for developing such comprehensive regional strategy. Over the past 3 years, Ukraine has faced challenges that have transformed our emergency response mechanisms. It is closely with the proposed WHO strategy for 2024-2029 aimed at strengthening preparedness, response and resilience in the WHO European region. We fully support the proposed strategy. Due to aggressive war by the Russian Federation against our country, Ukraine unfortunately has experience in key areas of emergency response, particularly in the healthcare sector during wartime, and we are ready to share this resilience experience with our partners. I want to emphasize the main aspects. Ukraine has established mobile medical teams with integrated digital solutions for disease monitoring and rapid response as envisioned in Preparedness 2.0. Our cross-sectoral approach to managing health risks and strengthening our healthcare system's capacity to respond under extremely challenging circumstances. We believe this approach could be useful for other countries seeking to improve early detection and prevention of threats. Ukraine is actively working on ensuring hospital autonomy to maintain continuous operations. We focused on 3 key criteria: water supply, electricity, and heating, to ensure uninterrupted services during crisis. We express our sincere gratitude to WHO for supporting to installation our 40 heating units in Ukrainian healthcare facilities, made possible with the assistance of Regional Director Hans Kluge, who recently visited our country. Thank you. We have implemented national mental health support program, particularly in regions affected by military actions. This reflects the community engagement principle of Preparedness 2.0. Ukraine has developed strategies to ensure the continuity of medical services even during hostilities. Thanks to telemedicine platforms, we maintained access to consultation and diagnostics for patients in high-risk areas. We are ready to share our crisis-based healthcare delivery experience with our partners. Ukraine has implemented national platforms for the rapid distribution of medicines and medical supplies in crisis situation. A key element is Preparedness 2.0. This strategy in Ukraine includes the establishment of regional medical reserves and optimization of procurement procedure, allowing for rapid adaptation for evolving conditions. Ukraine's experience in mobilizing resources and collaborating with international partners has demonstrated the importance of clear coordination among states. We support the recommendations of Preparedness 2.0 on building robust national structure for emergency response and call for strengthening international cooperation to mitigate health threats across the region. We believe that the joint implementation of Preparedness 2.0 will strengthen our healthcare system and ensure a better future for all of us. Thank you.
Thank you, Ukraine. As there are no more member states asking for the floor, we'll go now to invite the partners who wish to speak. Please raise your nameplate if you wish to do so. First of all, I will give the floor to UNFPA.
Thank you so much for the opportunity. UNFPA shares the concerns about the increased risk of global and regional emergencies that are rising from disease outbreaks, conflicts, and climate change. As we know, these crises exacerbate the existing vulnerabilities, particularly impacting sexual and reproductive health needs, especially for marginalized groups requiring enhanced and innovative approaches to health emergency preparedness and response. UNFPA has a strong history in emergency preparedness and response, supporting countries in strengthening health system and actors' readiness to implement the minimum initial service package known as MISP for SRH service provision during the crisis. We very much welcome the opportunity to collaborate with WHO and with member states on the 5 strategic areas outlined in the document, ensuring safe and scalable care while having a dual-track approach to ensure sexual reproductive health service continuity and responsiveness to population needs. It will be essential to fully incorporate sexual reproductive health and rights in the strategy implementations in line with the lessons learned in the region, the outcome of ICPD 30 review, and with the upcoming COP29 that, as we know, will take place in Baku very soon, and where UNFPA will be hosting or co-hosting several side events, including on the impact of climate change on gender equality, youth, older people, and on reproductive health. Coordination amongst sexual reproductive health stakeholders and across sectors is key, and we're glad to continue to co-chair with IRC, the SRH task team as part of the WHO Global Health Cluster, and we will be pleased to collaborate with member states to ensure SRH integration into all response phases. And I take this opportunity to kindly invite all ministers of health in the region and in the room to integrate SRH in the national preparedness and emergency plans of the respective country. And please count on us. We stand ready at UNFPA regional office as well at the country office level and with partners to support to build a more resilient future for all. Thank you so much.
Thank you. Now I'll give the floor to OECD.
Thank you, Madam Chair. OECD supports Preparedness 2.0. First, we support the building principles of Preparedness 2.0. Those principles underscore the importance of taking a broad view of health emergencies preparedness and response. Our work at the OECD has similarly shown the need to build the resilience of wider health systems and interconnected systems, and of communities as well, as central elements of response to crisis. Further, together with our dear partner, the European Observatory of Health System, the OECD has developed a methodology for stress testing the resilience of health systems in unexpected shock situations. Second, there is also a need to develop better decision-making tools in times of crisis. The COVID-19 pandemic has shown how health is closely linked to society and economy. Policymakers in times of crisis are confronted with very complex decisions on how to maintain the lives of people, as well as sustain their livelihoods, for which we lack decision support tools. OECD, with WHO headquarters and the World Bank, assess the benefits of mathematical models that integrate epidemiological, economic, and social dimensions. Further, the OECD is developing new tools based on the modeling of the health and economic trade-off of non-pharmaceutical interventions in the early stages of a health emergencies. We hope through this work to support improved decision-making for the future and look forward to continue cooperation with WHO regional offices on those matters. Thank you.
Thank you very much. Now I'll give the floor to the International Federation of Red Cross and Red Crescent Societies.
Thank you, Madam Chair. Distinguished Executive President, esteemed Regional Director, Excellencies, delegates, ladies and gentlemen. The IFRC Europe would like to start by extending our heartfelt condolences and deepest sympathy to Spain and the Spanish Red Cross during this difficult time in the east of their country. The IFRC wishes to thank WHO Europe for presenting the Preparedness 2.0 framework. This forward-looking approach to health security addresses urgent regional challenges with lessons learned from the COVID-19 pandemic, set against today's complexities of permacrisis and polycrisis. Europe is facing an interlinked web of crises: climate change, displacement, economic instability, and persistent health inequities that compound each other's impacts and stretch our health systems to the limit. These realities make Preparedness 2.0 essential. The International Federation of Red Cross and Red Crescent Societies in Europe, together with our national societies, is deeply committed to supporting its vision. Our role within communities and our experience in community-centered health preparedness align closely with the framework's whole-of-society approach. We are especially encouraged by its focus on community resilience building, recognizing that effective, sustainable health responses begin with engaged communities. Today's challenges require robust, data-driven decision-making and transparent communication, along with efforts to counter misinformation and rebuild public trust. In an age where crises are complex and trust in public health is fragile, transparent and accountable health systems are essential. The IFRC and national societies are ready to bridge communities and health authorities, working closely with member states and WHO to ensure equitable, inclusive health interventions that resonate with the communities we serve. I thank you.
Thank you very much. Are there other partners? If not, I understood the International Organization for Migration submitted a written statement which can be read on the official website. Thank you. The Secretariat received also 3 requests for joint statements to be delivered by non-state actors as follows. European Heart Network on behalf of World Heart Federation. Please, you have the floor.
Honorable Chair, distinguished delegates,
The European Heart Network and the World Heart Federation applaud WHO and its member states for the new regional strategy and action plan to bolster health security in the European region. It rightly recognizes that essential health services should continue whilst healthcare systems respond to emergencies. People living with non-communicable diseases, particularly cardiovascular disease, face significant challenges in emergency and humanitarian settings due to strained health systems, disrupted services, and limited access to essential care. People living with NCDs typically experience worse outcomes from a range of conditions, including COVID-19. An estimated 60 to 90% of COVID-19 related mortality was attributable to one or more NCD comorbidities, including an elevated risk of heart attack and stroke. We therefore urge member states to endorse and implement the Preparedness 2.0 strategy and to recognize people living with cardiovascular disease and other NCDs as a vulnerable population in health emergencies, to increase domestic mobilization and allocation of resources to address NCDs, especially CVD, by accelerating the implementation of the WHO NCD best buys. And during health emergencies, to ensure equitable, adequate, continued, and integrated access to essential health services and medical products across the continuum of care, from prevention and risk identification to diagnosis, treatment, and rehabilitation, particularly for people living with cardiovascular diseases and people in low-resource settings. We urge to have a strong focus on access to primary health care, whilst at the same time safeguarding mental and physical health of health workers. Finally, realization of universal health coverage, including investment in NCD prevention and care, is vital to ensuring healthy populations and resilience against future pandemic threats. Thank you for your attention.
Thank you very much. Now I'll give the floor to the International Council of Nurses on behalf of the European Forum of National Nurses and Midwives Association, the European Nursing Students Association, and the European Federation of Nurses Association. Please, you have the floor.
Honorable Chair, Excellence Delegates, and dedicated healthcare professionals. The signatories, speaking on behalf of the world's millions of nurses and midwives, supports the new regional strategy and action plan, emphasizing that a well-prepared and protected health workforce is vital for effective emergency response. To strengthen resilience and emergency preparedness, we offer two key recommendations. The first, the workforce capacity building and surge preparedness. The strengthening the health workforce ability to respond to emergency is essential. This goes beyond increasing the number of available healthcare workers during crisis to ensuring they are properly trained and equipped to deliver care in emergency settings. Nurses and midwives, constituting about 59% of global health workforce, are at the heart of these efforts. And we call for active involvement of nurses and midwives in emergency preparedness, including surge capacity planning and training in disaster response, triage, and crisis management. Equipping nurses and midwives with skills in emergency care, mental health support, and trauma management is crucial for improving overall emergency response capabilities. Secondly, protecting health workforce and safeguarding rights is essential to ensuring they can respond effectively in emergency and ensuring the continuity of health services. We advocate for the protection of health workers and healthcare facilities, underscoring that they should never be targeted in conflicts or crises. Health workers must be allowed to provide care impartially without fear of violence. As mandated by international humanitarian law, and particularly Geneva Convention Additionally, we urge member states to uphold the rights of health workers the rights of the health workers, ensuring fair compensation, sufficient resources, and support for their mental and physical well-being during and after the crisis. Investing in nursing workforce, capacity building, surge preparedness, and the protection of healthcare personnel is essential for the European region to meet the growing challenges posed by emergency and disasters. We remain committed to collaborating with member states to achieve these goals. Thank you for your attention.
Thank you very much. And now I will give the floor to EuroHealthNet on behalf of European Federation of Nurses Association, European Forum on Primary Care, European Heart Network, European Public Health Alliance, the European Public Health Association, International Diabetes Federation European Region, International Federation of Medical Students Associations. Please, you have the floor.
Thank you very much. Dear Chair, Regional Director, Honorable Ministers, and distinguished delegates, let me begin by first congratulating Dr. Kluge once again on his re-election as Regional Director. We count on your strong leadership during these challenging times. EuroHealthNet and co-signatories welcome Preparedness 2.0's grounding in principles such as equity, community centrism, good governance, and the One Health approach. This reflects lessons well learned from the COVID-19 pandemic. It is divided into 5 strategic areas and complemented by an implementation support guide. As reflected in the guide, the plan must be accompanied by wider measures to support an effective response to crisis. We offer the following 4 recommendations to help implement Preparedness 2.0. 1. A stronger focus on health promotion. The strategic area on community resilience and protection aims to make community protection the end goal of emergency preparedness and response. The focus on dual-track and whole-of-government responses is encouraging. Yet for these responses to be effective during crises, they must already function well in daily operations. We therefore encourage aligning actions with the framework for resilient and sustainable health systems to create health-promoting systems that protect population health before and during crises. Such systems are effective countermeasures as they build trust and improve resilience. 2. Cross-sectoral governance to address determinants of health. The strategic area on emergency coordination, in that strategic area, we advocate for governance structures which clearly define communities' roles in an emergency response. We also note that effective emergency coordination should incorporate the wider determinants of health, including education, job security, food and nutrition security, and access to nature. A cross-sectoral approach will mitigate crises' disproportionate impacts on vulnerable communities. 3. Scalable mental health. The strategic area on safe and scalable care emphasizes adaptable health systems for emergencies, but overlooks the need to scale population mental health services, which are often excluded from national healthcare systems. Acknowledging emergencies' emotional and psychological toll, we recommend a dual-track approach to mental health as well, with surge capacity to address both community and health worker needs in times of crisis. 4th and finally, as many others have already emphasized today, further consideration of climate crisis adaptation measures. Across all strategic areas, we must do more than just environmental surveillance. Building on existing WHO materials, such as the Guidance for Climate Resilient and Environmentally Sustainable Healthcare Facilities, we urge a stronger focus on climate crisis resilience in the action plan. We can better protect vulnerable populations and enhance equity through cross-sectoral collaboration, implementing adaptation measures to climate crisis, heat health action plans, and flood-resilient infrastructures, which, for example, could have helped to mitigate the tragic situation in Spain. In conclusion, the co-signatories of this statement endorse the action plan and look forward to support its implementation, strengthening the aspects of health promotion, cross-sectoral governance, mental health, and climate crisis adaptation. Thank you very much.
Thank you. I have to inform the delegates that the Secretariat also received a number of written statements which can be read on the official website. Thank you, all of you, for your statements. Now we will break for the lunch and we take the Secretariat response after lunch. Please, the meeting will resume at 2 p.m.
Thank you, Madam Chair. And just to advise delegates that lunch is available in all 3 lounges, and please return to the room for 2 p.m. Thank you.
So now we'll listen to the remarks and response from the Secretariat regarding your statement on the agenda item number 10. So, Dr. Gundo, please, you have the floor.
Thank you, Professor Pistel. And let me first appreciate the strong support and commitment that all of you have expressed for the principles of the strategy, but also the content of the strategy. A lot was said, and of course, we've taken very careful note of each of your comments and suggestions, in particular those that are already looking forward to implementation of the strategy. Many of you have talked about the role of communities, and I want to appreciate in particular our non-state actors and international partners, such as IFRC and UNFPA, who spoke to this. I should say that we could not agree more with how central community involvement and protection is. And as you may know, our regional director has actually created a specific team on this, on community engagement in our emergency division, to ensure not only social participation, but also to combat misinformation. Our NSA partners have also pointed out that there are diverse populations who experience vulnerabilities, and we've taken care to choose inclusive language in the strategy to reflect their needs, including on non-communicable disease, treatment continuity, on mental health, and on sexual and reproductive health needs. Many of you have raised the importance of equitable access to countermeasures, including to medicines. And of course, we realize that healthcare workers are central to implementing countermeasures and ensuring service and treatment continuity. I want to thank the Council of Nurses and a whole range of member states who have highlighted the importance to capacitate our healthcare workers and to protect our healthcare workers at any time, including their mental health. One other central theme that ran through your interventions was that of coordination and cooperation amongst all sectors, taking an all-hazard and one-health approach. This is indeed a key component of the strategy, and we do hope as well that the strategy now, as you're starting to use it, can also help to bring sectors together. I want to thank particularly also EuroHealthNet and others for underlining the much-needed focus on health promotion and to address the determinants of health. Now, ultimately, you've spoken to many issues that cut across the 5 Cs, and they're all of equal importance. Our preparedness is only as strong as the weakest part in the chain of the 5 Cs is. And that's why we've taken an integrated approach to those 5 Cs. But integration also applies, of course, and in particular, to integration with the broader health systems framework that we discussed in the first session. And both frameworks are indeed closely interlinked, and want to thank also OECD for their remarks on health systems resilience. The same applies also to our work addressing the climate crisis. Some of you have addressed a few issues that pertain more to implementation. And first, let me recognize that we realize that not all paragraphs and actions proposed are equally relevant for all countries and for all health sector mandates, so that are hugely diverse across the region. So your comments on this are well noted, and indeed, the plan represents a collation of actions. And we are fully aware that countries will deliberate carefully which one are the most appropriate ones for them to implement for their context. And we'll be happy, of course, to support you in this. And I should point to our collaboration and support to 15 countries that has already led to the development of national action plans for health security. Many of you also talked about financing, very important. And as we heard yesterday in the program budget discussion, actually, the WHO emergency program is amongst one of our pockets of poverty. And we are conscious that the same applies also to financing preparedness at the national level, because we all still do often see that after the panic comes the neglect and with this, the decrease in funding. So we hope that the plan that mentions funding throughout will also be an instrument that you can use at country level to ensure sustainable funding. Many of you have emphasized the important alignment. I really want to just say one final word on that. This has been an issue which has been at the fore of our mind while developing the strategy with you. Talking about alignment at the global level, of course, with the global HEPA framework. We are actually quite proud we are the first region that is applying that framework in a strategy, but also with the One Health Joint Action Plan and some of the resolutions, including the one driven by Croatia and the World Health Assembly. But then there's also alignment with the sub-regional strategies by the EU, by the Eurasian Economic Community, Organization of Turkic States, and others, which is also reflected in the strategy. And finally, commitment to IHR, to the IHR amendments and to the pandemic agreement came clearly out of many of the statements that you've made. Already we have taken steps to prepare countries for implementing the IHR amendments, and thanks again to Bulgaria for the excellent meeting of the IHR focal points. But we also have enough strategy and flexibility in the strategy to incorporate aspects of the future pandemic agreement. So in conclusion, we do realize this is a strategy that is comprehensive and ambitious, but it's also a problem that we are facing that is complex and big. So ultimately, we can only implement it together, and I really appreciate also the many instances where you offered to share your learnings horizontally with other member states, and we certainly want to be by your side every step in the implementation of this strategy. Thank you. Back over to you.
Thank you very much, dear Gundo. Now, I would like to conclude this agenda item. For the beginning, I want to ensure Russian Federation that the Secretariat noted the remarks to be included in the report. So we are now ready to consider the adoption of the proposed draft decision contained in the document EUR/RC74/conf/1 on health emergency preparedness, response and resilience in the WHO European region 2024-2029 and its related costing. Is the committee willing to adopt the proposed draft decision by consensus? I see no objections. Therefore, the decision is adopted. Before we conclude totally this agenda item, I will give the floor to our regional director for its final remarks. Please.
Thank you very much, Madam Chair. I would like to acknowledge that these interventions confirm that the national health security will remain a defining issue for the next 5 years in Europe. I started with that one in my Handstock 2 days ago, because it's the one issue that even as COVID-19 has largely disappeared from the public eye, it remains a concern for communities and politicians across the board. And this is also our chance as global health diplomats to keep health high on the agenda. Second point, Gundo mentioned indeed that the Preparedness 2.0 upholds the approach of a dual track, a main lesson learned from the COVID-19. And as Minister Jo Etienne Abela from Malta eloquently reminded, the mental health of the health workforce to be really incorporated, but also the NCDs, non-communicable diseases, in the emergency response. I would like to thank all the countries which are contributing with emergency medical teams. I have seen at the front line, in the field, the immense contribution, be it in Turkey after the devastating earthquake, or in Armenia, which was overloaded one time with more than 100 very severely burned patients. So thank you very much. This is very, very much appreciated. Thank you to Turkey also for the GDO in Istanbul, which is a great operation instrument. And if we talk about man-made disasters, my final point is to echo the call of the WHO Director General, is of course the call for peace. I had promised Dr. Sergei Dubrov yesterday, right, that when and if re-elected with a strong mandate, that support to the health system, the healthcare workers, to Ukraine will remain a top priority in my agenda. And I would like to remind also that even during war times, it's very important for people in captivity that they have access to medical care. I want to thank also all the countries which I met and committed to the medical evacuation from extra children with cancer, heavy wounds, and accompanying persons from Gaza. Thank you very much for this, and also to Commissioner Stella Kyriakidis, who agreed to put this on the agenda of the health security agenda. It's very important. Remember, one child saved is humanity saved, and we're going to continue also to work on mental health and gender-based violence of the victims of the terrible attacks of the 7th of October with the Ministry of Health of Israel. Thank you.
Thank you, dear Regional Director. And now for the next agenda item, I will pass the chairing to the Deputy Executive President, Dr. Thomas Denser. Please, Thomas.